Welcome to TCN Talks. The goal of our podcast is to provide concise and relevant information for busy hospice and palliative care leaders and staff. We understand your busy schedules and believe that brevity signals respect. And now, here's our host, Chris Como.
Welcome to TCN Talks. Hello to everyone, and I'm excited today. We have Carole Fisher. She's the president of the National Partnership for Healthcare and Hospice Innovation, senior advisor with Healthcare, an executive coach, a speaker, and a podcaster. Welcome, Carole.
Thank you, Chris. I'm thrilled to be here. I'm excited. Thank you.
I'm excited as well. And we also have with us Bill Keane. Bill's the vice president and director of strategy at Emergence. Welcome, Bill.
Great. Thanks for having me.
So, Carole, why don't you go first? What does our audience need to know about you? This is not your first time on our podcast, but it's always a good opportunity to connect with the audience.
Oh, my gosh. Well, again, I'm thrilled to be here, and thanks for having me back on and including Bill and the work we're doing with Emergence. It's important work. I guess what I'd like everyone to know is I'm committed to social impact, and whether it's end-of-life care, whether it's domestic violence, which I have just accidentally gotten involved with through the podcast, The Girlfriends. My commitment, I was born and raised as a social worker, and so my commitment to making the world a better place is always first and foremost in everything I do.
Well, I got so much admiration and respect for you, Carole, but, something just hit me because, I'm all up in this, writing this book right now. Living a cause and purpose and putting a focus. Years ago, Stephen Covey would say that, someone who's focused in their area of influence, it's like dropping that pebble in the pond and your influence impacts the world. I've known you for so long now. I didn't have any gray hair when we first knew each other. And I just see the more focused you become, the more impactful you are in the world. And I just want to give you a shout out on that.
Oh, thank you, Chris. That means the world to me. Thank you.
Well, Bill, so this is your first time on the podcast. What's the audience needs to know about you, but also would love for you to weave in who is Emergence?
Yeah, absolutely. So my name is Bill Keane. As Chris said, I'm the vice president and director of strategy at Emergence Creative. So Emergence is a global creative agency. We specifically work on social impact. So we work across a number of domains, sustainability, urban innovation, civil rights, social justice, but in particular, public health. And over the last couple of years, I've had the opportunity to work both with Carole and the NPHI team, and then also with Hospice of the Piedmont, which is an NPHI member based in Charlottesville, Virginia. And so we've really developed a deep understanding of the sort of declining health, end of life, serious illness aspect of the healthcare system. So it's been an interesting kind of journey for us alongside our other public health work in other parts of the healthcare system to really get to know this space and this industry and really the wonderful people who make it up. So thanks so much for having me.
Now I kind of hear all that background, Bill. I think I kind of knew that, but listening and now seeing this amazing report, which we're going to get to in just a second. In fact, I think Carole and I talked about it, and those of you on video, you can see I just kind of put it up on the screen. It wasn't actually published yet, but now I see how just that whole gestalt of experience of how you brought that into bear in this study. So just with one of you, just real quickly, what is a brief summary of this study? Why was it done? And then we'll get into more specific questions.
Yeah, well, let me take the lead on that. We wanted to create something of value for our membership. We have 100 members, both large and small throughout the country, all providing end-of-life care. And we wanted to help them showcase their value proposition. So hence why we took a dive into this work. Our members are seen as the trusted authorities in their local communities, and then collectively, regionally, and nationally, we're all recognized as a trusted voice in advanced illness, hospice, and palliative medicine. So this report really brings together extensive data, new public opinion research, real-life stories that I know Bill can speak to, that really explores perspective on how Americans feel about healthcare. And it's important. We know that as we were moving into this, about 18% of the population have only feel trust towards the U.S. healthcare system. So this became really important for us, especially post-COVID pandemic. So with that, I'll hand it to Bill, who just speaks so eloquently about the work that we did.
Yeah, thanks, Carole. I think, from the outset of our work with NPHI, we were really just trying to understand the field and some of these kind of big systemic and structural issues that are happening in the hospice industry, the policy dynamics, certainly, but then also what's going on day to day for members of NPHI in their local communities, facing increased competition from some of the bigger for-profit players in the space, and just how that has evolved over the last couple of decades. And so I think that this blueprint was really intended to kind of reckon with some of those big structural kind of systemic issues, but then, as Carole said, to also really ground it in what does the public think and feel, and kind of where are they coming from? What's leading them to make decisions about their own care and care for their families? And I think to try to bring all of that together into sort of a new narrative of how organizations like NPHI and its members can really talk about what they offer and the kind of the key role they play in society around such a critical issue.
Well, it just hit me, Bill and Carole, the importance of the time that you did this. Carole knows about this. We've done this fascinating project with our TCN membership where we've done a 360-degree external environmental scan and forward-looking scan and tried to bring it down to a concise of here's what's coming. And of course, one of those biggest challenges is I've got 28 years now in this movement. Carole has as many. And so the greatest generation has been who we've cared for, and that is shifting now to the baby boom generation. So the fact that you've done this at the timing of right now, and the data in here is just pretty incredible. Now, you titled it People Over Profits. Why on earth did you title it that?
Yeah, so I think, first I would just say, I think it's interesting that, that title has kind of struck a lot of people as provocative, and it's maybe ruffled some feathers. And, if we take a step back and really think about that idea, that in healthcare, people should come before profits, do any of us really disagree with that? Do we as a society actually think that profits should come before people? I don't think anyone would make that argument. So I think to us, that's really not a controversial statement. But to go back to the point Carole made about public trust, one of the central findings of our large quantitative study that we did for this was that, only 18% of the American public trusts the healthcare system to put their well-being ahead of profits. So I think that tells you both kind of the extent and kind of depth of that distrust, but also really the source of it, which is this perception that, profit has kind of gotten in the way of providing really quality care, that really honors and respects individual preferences. So I think that was sort of the genesis of it from our perspective. I do want to acknowledge, it would be reductive to just say, for-profits are bad and nonprofits are good, and that's all there is to the story. That's really not what this is about. But I do think we have to acknowledge that, the pursuit of high profit margins has really radically changed the industry. And as you see from some of this data, it's something that is on the public's mind. And so as we think about how to kind of message and tell that new story of what NPHI and its members offer, I think we can't shy away from that. We have to kind of acknowledge that that's how people are feeling. And I think NPHI is well positioned to kind of offer a sort of counter narrative to that.
Yeah. And and thank you for mentioning the for-profits bill. Anyone that works at the bedside is just an amazing human being that, I think you both have heard me say, I have great respect and hold their work in high regard. But the profiteering aspects in end-of-life care right now is really off the charts. And this was a way to act on that. This was a way for us to say, look, we have a commitment. We were the first ones in the home doing this for the right reasons, doing this before reimbursement from Medicare even existed. And, and I say we on behalf of our members, we put people over profits every single time. So it's an important message, and it really helps. I think Bill and team have done a great job of helping us articulate who we are in a different way than just leading with we're here to, as a hospice provider.
Yep, that's well said. Well, if it's okay with you guys, I'd love to just read an excerpt real quick. The executive summary was I just felt poignant and on point. And by the way, Bill, you guys, I'm writing my first book. Carole wrote the foreword. So I'm very keen lately to people who craft words. Your team is very skilled in this area. So major kudos. And so it's titled, it says, Good Times, Bad Times. United States healthcare system is facing a reckoning. A set of interconnected social, demographic, medical, and economic forces are radically reshaping how healthcare works and doesn't work in our society. Despite America's reputation as a world leader in research, innovation, and treatment, health outcomes at the population level are getting worse, even as costs soar. The reason for this is not necessarily that people are getting sicker or that they're getting sick in new ways. Many of the factors that drive high costs and poor outcomes could be managed effectively and efficiently. Instead, our fractured healthcare system often stands in the way of coordinated, comprehensive, human-centered care. Resolving these tensions will require grappling with the experiences and attitudes of the American public, as well as the systemic factors that shape their perceptions. Based on that understanding, dramatic pause here, community-based, mission-driven organizations can offer a new narrative of what healthcare can and should be. So what did you mean when you said community-based? Because it feels like this feels very intentionally chosen. Like I could feel the energy of your team and all of what they learned and the time they spent with all the amazing NPHI members and the research study you did. I could feel the energy in this statement. And so what does it mean when you say community-based, mission-driven organizations can offer a new narrative of what healthcare can be and should be? So how so?
Yeah, it's a great question. And I think one of the things, for us, as I mentioned at Emergence, we do a lot of public health work, and we've worked on mental health and chronic disease and population health. But, getting up to speed on hospice and sort of the history of it, and in particular, the philosophy behind it and the sort of model of care, I think one of the first things that we realized was a lot of the topics and sort of themes and aspects of that model of care that go back, 50 years at this point, those are now topics that are being discussed more widely in healthcare. And they're in some ways even being touted as sort of the future of healthcare. When you think about issues like social determinants of health, multidisciplinary teams, home-based care, shared decision-making, a lot of these topics that, hospice leaders know very well and have been emphasizing now, from day one. Now you're starting to see that come through in other parts of the healthcare system. And I think part of what we were proposing with this blueprint with the People Over Profits study was to really say that NPHI and its members and organizations like that should really be viewed as trusted leaders and as a sort of authority on some of these issues. And so there's a real opportunity for NPHI to kind of stand up and own that leadership position. One of the things that I'll just mention anecdotally from some of the qualitative research we did some interviews with caregivers and heard their very personal stories. And part of that exercise was we asked them, imagine your ideal type of healthcare. Like, what would you really want for your loved one in a perfect world? And what they described almost, to the individual was exactly what these community-based, mission-driven organizations have been doing all along. They just don't know what it is. They don't know that that's available. They don't have the word for it. But what they describe is exactly what, Carole and others have been doing now for 50 years. And I will say, actually, one participant literally said, it should put people over profits. That came directly from something that someone said in one of those small group discussions. So I think that idea is resonant. It's just, that story hasn't come through in a really cohesive way.
Yeah, boy, there's so much good there to unpack. Something that occurred to me is probably not the perfect analogy, but, if I throw up a couple rooms in my house and I had a couple of things that would beep and little line and go, that's a hospital. Well, people go, that's crazy. We know that's not a hospital. But yet, because we've been so passionate and so heart-driven as hospice people, we have not been the best to articulate this amazing specialization, skills, systems, and processes to create this amazing model of care. And Carole, you've been one to kind of pull me aside to say, we've got to get better at telling that story. So thanks for your part in what you're doing with that. And one of the things that you said in here was from a customer perspective, understanding our customer, you had this whole section identified the top concerns about aging, which I felt, man, that's solid gold. If we think about the customer, what does the customer value? I think sometimes we get caught up in like, our CAP scores and like all of the data, and you forget that survey is supposed to be telling us what the customer values. And so can you talk about that section? Can you share what came out of that?
Thank you to our TCN Talks sponsor, Delta Care RX. Delta Care RX is also the title sponsor for our May and November 2023 Leadership Immersion courses. Delta Care RX is primarily known as a national hospice, PBM, and prescription mail order company. Delta Care RX is a premier vendor of TCN and provides not only pharmaceutical care, but also niche software innovations that save their customers time, stress, and money. Thank you, Delta CareRx, for all the great work you do in end-of-life and serious illness care.
We learned a lot in that section, didn't we, Bill? I mean, we heard loud and clear from people, individuals expressing their concerns about a loss of independence, about a loss of quality of life, about their declining health. Financial worries really came through loud and clear. Will I have enough money to care for myself as I age? Social isolation and loneliness was really a key concern. I think it's like 50% of adults over 65 reported feeling lonely. And, you and I know, Chris, and now Bill knows as he's journeyed into healthcare, that when you feel isolated, it relates to an increased risk of functional decline. And we see that a lot with dementia. So we started learning all this, that folks are really concerned about wanting to stay at home, age in place, but they don't want to be a burden and they don't want to lose their independence. And they have concerns about, what if my spouse dies before I do? What if I become a burden to our families? What if I'm not able to live alone? So we just it just came through loud and clear that I think it was like 76% of people believe that growing old is a problem and that it's becoming a burden on the healthcare system. And, to your point earlier, we're in the baby boomers now are aging, I'm one of them. So I see the struggle is real for folks. And I think what's important that Bill and team helped us do at Emergence is really position our communication and our messaging to address these issues and to speak eloquently to them in a very unique, individualized approach.
Well, you had another section, and this was encouraging. There's been so many challenges and systemic impacts on our society from COVID, but one of the, if you could say it's a positive, it certainly has accelerated the fact that you can bring healthcare into the home. And so you guys had a whole section dedicated to the home, and I love the way you titled it, Bring It All Back Home. Can you share what that was about?
Yeah, well, first, I can never resist a Bob Dylan reference in my writing there. But I think, as you said, that is something that we've seen particularly coming out of COVID, but really it was already kind of in progress before that, was this sort of shift in both patient preference and then also potentially from the system's perspective to care in the home as a potential, growth opportunity for healthcare. And so I think at the same time, we know one of the most common misconceptions people have about hospice is that it is a place that you go rather than a kind of model of care that is typically provided in the home. So I think, that's something I know that Carole and others have spent, many, many years trying to kind of overcome that misperception. But I think we wanted to, again, emphasize that because it is one of the unique aspects of what hospice offers, is the sort of home component of it. But then, as you said, we're seeing this increased interest in home-based care, both from the private sector in terms of big investment into new technology that can enable more home-based care, home monitoring, telehealth, things like that. And so as we see this growth, as you said, there's a lot of reason for optimism and excitement around that. There's a real potential here to kind of marry what the system can gain in terms of efficiencies that are available through home-based care, but also patient preference. We know people from a convenience perspective, a comfort perspective, of course, they would rather receive care at home. So I think that's a really exciting opportunity. I think the question is, how are we building those systems and models of care in the right way so that, we're incentivizing the right things and sort of promoting the right approach to it? And again, I think it comes back to this idea that, hospice providers and NPHI and its members, they've been doing this longer than anyone. They know it in and out, better than these other aspects of the healthcare system, and certainly better than I think, some of the kind of technology startups and things like that are becoming interested in the space. So I think, it all comes down to we need all of those stakeholders to kind of participate in this. But again, I think there's an opportunity for NPHI and its members to really stake their claim as a sort of leader and as a sort of thought leader and innovator on this topic, to ensure that as we kind of evolve the healthcare system towards more home-based care, that we're doing it, in a respectful and a dignified way that really values patient preference and ensures quality.
That's really good. I'm going to read this one because you quoted Dr. Gwandi from his book, Being Mortal. It said, home is the one place where your own priorities hold sway. At home, you decide how you spend your time, how you share your space, and how you manage your possessions. Away from home, you don't. And Carole, you said something to me at the end of an NPHI meeting, and I forgot exactly what it was, but it was around social determinants of health. But you said it in such a way that struck me that sometimes we've been so close to this model of care. It's what we do that we don't realize there's certain aspects that are incredibly profound. You think about in sports, right? If you're playing at home versus away, there's a whole different strategy in that. Mm-hmm. When we're going into people's homes and the fact that we've gotten comfortable and really good at that, like how you walk humbly in someone else's home, but yet how you meet them where they are and you walk alongside them in this disease trajectory, there's a whole skill set there. And we just do it. And I think we kind of lost sight of that's fairly unique. If you're in a hospital, people are coming on your turf. And so the fact that we have that competency and I think the beauty of your report, again, COVID has accelerated the fact that you can actually do this. We could push a lot of healthcare into the home. There's even, there was a CMMI grant to actually approve ICU in the home. And so that is the future. And we know that baby boomers will want to go there as well. Any additional thoughts that before I go to kind of a question I had for you guys to wrap us up?
Yeah, I just think that it's always important. And I know that our NPHI members understand this, they're proficient in this, they're effective in this. We are guests in a person's home. And it's just always good to keep that top of mind. And I think we see a lot of healthcare moving into the home without having the history and the expertise that hospice and palliative care providers that our members have. And so I think that's why we excel in people's homes, that why people allow us in and feel confident with us and feel trusted, because we recognize that we're a guest. We're not intrusive in the care that we provide. And there's an opportunity to really communicate that in a way using people over profits and taking some of that information out of the document to really communicate that to people that need our care.
That's great. Well, so you've got the ear of a lot of hospice and palliative care leaders. You did this amazing project and study. What's your advice to them?
Oh my gosh. Well, I think that remembering that it's always important to lead with what problem we're trying to, a problem that we want to help someone else solve. And so leading with that, taking the time to speak with the collective voice. We have several different audiences, certainly the patient and the family member, but another audience is who makes that referral. Another audience is the payer. Certainly the people on the Hill. So really making sure that we tailor our message to raise awareness, to continue to show that we're the expert in delivering home-based care for patients and families. We know how to navigate declining health, advanced illness, and bereavement. And I think this blueprint ultimately provides organizations with these tools.
I'm sorry, Bill, were you going to say something?
No, I would just echo what Carole said. And I think, it maybe sounds a little cliche, but at the end of the day, like the care that you provide, your staff, the workforce, that is where this all comes from. It's not about marketing and some of these other things. It's really about the care at the end of the day. That's what sets these organizations apart. So continuing to do what you're already doing is, I think, at the foundation of it. But to Carole's point, finding a way to tell that sort of unified story, to emphasize some of the unique benefits of what these organizations provide, I think that's what we're trying to achieve with some of the work that we've been doing with NPHI.
Which is why it's so important, but so flippin' hard. And so I always find it fascinating. Carole knows me, that she knows I'm a geek about business. And I grew up in the Fortune 50 world, and it just used to fascinate me. How do you take a roll of steel and a car rolls out on the back end, and how does people and processes and all that stuff? And lo and behold, I end up in hospice, and just my love and affection for the people by the bedside. It is magic. It is amazing what they do, and they are truly amazing people. But I also get fascinated by the systems and processes by which they do what they do, and then in the business parts of that. And so I always felt this, having lived in the other business world, hospice is kind of like Broadway. They say if you make it on Broadway, you make it anywhere. Hospice is super complicated because Carole was alluding to, there's so many different stakeholders. And the challenge of marketing is how do you tailor a message to the person who needs to hear the message? Well, we have so many different stakeholders. So what works for the customer, patient, family, may not work for the person on the hill, may not work for the facility partner, may not work for the hospital partner. And that's what makes general business principles, marketing, things like that, so much more complicated in our space. And so kudos to you guys, because that's also part, I think, the brilliance of this work is this messaging that gives you great tools in any of those spaces, actually. So again, major kudos. So final thoughts from either or both of you?
Well, I want people to know that they can go to our website, hospiceinnovations.org, and you can find the blueprint there and certainly read it and become familiar. I also want people to know you don't need to be well-versed in the subject. You don't need to be the marketer or the business development person. This is not just for policy folks. This is really a comprehensive toolkit that can be used for all. So I think, I want everyone to see it and appreciate it and value the wealth of information inside the document.
All I would say is just I want to extend a big thank you to Carole and the NPHI team for kind of bringing us on and sort of giving us this opportunity. But in particular, to really just thank all of the NPHI members. I've gotten to know so many of them over the last year or so that we've been doing this work. And, as you said, Chris, so many of them, there's just such a passion, such an authenticity and sincerity that comes through. It's easy to kind of get lost in the systems and the structures and the processes, but, that these people are in the communities every day, doing that work. I just have such respect for it. And so it's really just been an honor to be able to work on this. So thank you to Carole and the entire NPHI community.
And thanks to you and your team, Bill. There's so many people that the curiosity of your team was so impressive to me. I mean, I love that. And Carole and we've gotten our masters in leadership together, and we were taught this term called the learning mode, which is how to spend life in just a general curiosity. And your team modeled that beautifully, which is why I think the product was so good.
Oh, thank you so much.
Well, I'm gonna close with two quotes, and I ran this by both Bill and Carole, and it both felt apropos, so I couldn't pick one. One is from a mutual friend of Carole and I, one of the students in the classes that she and I teach, is from Angie Barker. She probably doesn't even know I'm using her quote, but I love it. She said this out loud: "Your windshield is bigger than your rearview mirror. Which one do you spend more time looking through?" Love that. And this one from D. Hawk: "Change is not about understanding new things or having new ideas. It's about seeing old things with new eyes from different perspectives." Thanks for listening to TSAN Talks.